So as a nurse of a first initial assessment will be assess for the patency of airway, whether the patient is able to pass airway, whether he is fit, fine or not. Then for breathing, we will check respiratory rate saturation and perform a respiratory examination. Generally the patient with the PE is hypoxic, so we'll prescribe the oxygen. Whether it will be depend upon the type of rate extending of hypoxia coexisting conditions, for example COPD, or pulponing the chest wall may help to exclude musculoskeletal pain, costochondritis. Percussion would allude to the presence of pneumothorax, for example hyperresonant or pleural effusion in pneumonia, because there may be dullness due to presence of consolidation. Presence of wheeze or crackles may allude to acute heart failure, which can be caused by the pulmonary embolus, asthma, pneumonia. Number 4, there will be assess the circulation. We assess hemodynamic stability via the pulse or BP. Hemodynamic means we will check the blood flow mechanism, whether it is normal or not, and also perform the full cardiovascular examination looking for the sign of pericarditis, like there will be the presence of pericardial friction drop or increased AVP may be seen in the patient due to pulmonary embolus, because it caused due to increased pressure in the pulmonary artery. Number 5, will assess for the disability. Here will be check the GCS, Glasgow Coma Scale. Though Mrs. Smith was well spoken, elderly patient may present with delirium in atypical cases of PA, and also the monitor blood sugar level, whether it is normal or not. Then under initial investigation, we will see the AVG, which is the arterial blood gas. It depends upon the size of embolus, whether it the larger PE or the patient hyperventilation will result in a respiratory alkalosis with decreased PaCO2. That means larger PE, there may be the decreased PaO2, and also due to larger embolus there may be the saddle and also cause metabolic acidosis due to hypoxemia and anaerobic metabolism. Here also think the blood profile and check for the FBC, UES, CRP clotting, D-dimer if negative rules out PE. Look for the infection signs, pneumonia, and also the evidence of SCS mounts run a troponin. Through a PE may also have an elevated troponin. On chest X-ray, we will see whether the chest X-ray report is normal or not, whether there are some presence of excluding pleural effusion, consolidation or pneumothorax, and also the possibility of fractures. ECG. Tachycardia is the most common signs due to hypoxic.